Hi, my name is Charlie Wilson and I'm New Hampshire's Kid Governor. I am happy to introduce Miss Jody Lubarsky. Miss Jody is the Child, Adolescent, and Family Services Director with Seacoast Mental Health. She has agreed to talk with me today about how to deal with depression and sadness. I ran for New Hampshire's Kid Governor because I wanted to get the message out to the kids of New Hampshire that if you're feeling sad or depressed, you're not alone. I am happy that Miss Jody has agreed to help us recognize signs of depression and give us ways to get help and give help.
Hi, Charlie.
Hi.
Thank you for having me here today.
Thanks for being here. Thanks for meeting with me today. Would you please tell us a little bit about yourself?
I will. And again, I want to thank you and the team for inviting me. This is such an important topic right now for us to be talking about. So currently I serve as the Child, Adolescent, and Family Services Director at Seacoast Mental Health Center. This is my 14th year at the center, but I've been working with children and families for 24 years now. And along with being a licensed clinical mental health counselor in the state of New Hampshire, I'm also a certified youth mental health first aid instructor. And I like the idea of youth mental health first aid because it teaches parents, teachers, counselors, coaches, you name it, any adult who works with a child can learn the signs and symptoms of mental illness for a young person, how to give them support and get them to the care that they might need. So that's what I do currently.
I was very sad during the pandemic and I was diagnosed with situational depression. Can you tell us a little bit about situational depression?
Absolutely. And, I think it's so important that we talk about this because I feel like right now we're living a pandemic within a pandemic. When I think about myself as an adult and the other adults who are with us today, we've at least had the privilege of having some life experiences to help us through what has been a challenging 15 months. But for yourself and other kids, this is probably some of the first experience you've had with change or loss. And it's thrown everybody a curveball, really. And so situational depression, sometimes it gets referred to as adjustment disorder, is really when we have depression related to life stressors, events. It could be a loss, it could be the pandemic like we've been going through, but any stressful event that happens within our life that helps to accelerate or bring on those symptoms of depression. And how that looks for each person can be quite different. Adults can have that experience of situational depression as well. And it's really different than what we call kind of those everyday blues. I might have woken up this morning, maybe had a bad day, maybe something happened that's left me feeling a little sad, but I tap into my resources, my strategies, and maybe a day or two later, I kind of recover from those everyday blues. But situational depression is something that prolongs longer than just a day or two, and it starts to have an impact on our daily living. We start to see changes in the person, maybe we're not experiencing things the same way we did before, and leaves us with feelings of sadness.
What are some of the signs families, friends, and teachers can notice if they're wondering if they're feeling sad or depressed?
So, one of the things that I have always said to parents and caregivers in my career is you know your child best or your children best. So we really lean on the adults in a child's life to be able to recognize when something's changed or something's different for them. So when we talk about with parents or caregivers about whether or not their child might need some professional supports, we really start to ask what's looking different. Are you seeing dramatic changes in their mood? A child who maybe is usually quite happy or gregarious and outgoing, if they now seem a little bit more sad, sullen, they're starting to isolate themselves from others. They're not finding that enjoyment or that pleasure in those activities that they once enjoyed. They may be a member of a sports team and they're saying that they don't want to participate on the team anymore. Definitely when we start to see those changes in appetite or sleep habits, and those could be increases or decreases, maybe just agitation or anger. And I think especially with young kids, this is a sign that often gets overlooked. A lot of times adults will say like, oh, they're just being oppositional or they're angry. And really for a lot of young kids, those feelings of anger really come from that discomfort that they're feeling because they're feeling so sad and they don't understand it or how to deal with those feelings. And so it comes out as anger instead. And especially with their parents or caregivers, because this is your soft place to land every day. It's that place where you can be yourself, you can share your feelings, and hope that you're not going to be judged for those feelings. So those are some of the immediate signs. Of course, if we have a young person who starts expressing thoughts of wanting to hurt themselves or anybody else, these are really increased signs that it's time and important to get some professional help.
How can kids find the courage to seek help when they're feeling sad or alone?
Wow, that's a big question, because I know when we had our opportunity to chat yesterday and meet with each other, we talked about that idea of stigma. And I think stigma is something that makes it really difficult for both adults and kids to feel comfortable talking about their mental health. I had shared with you that something that's really important to me is that we all be ambassadors for good mental health and be ambassadors for removing the stigma when it comes to talking about mental health and mental illness. You know, I really believe that we should be able to talk about mental health the same way we talk about allergies or asthma or diabetes or high blood pressure. We know when we're not feeling mentally well, that has an impact on our physical health. And so if we can't talk about feelings of anxiety or depression or even experiences of trauma, which could lead to mental illness as well, then we're not allowing ourselves to be physically well the way we need to. So in order for kids to feel comfortable and safe, first they have to have trusted adults within their life. We need to make sure as adults that we're making ourselves available to the young people in our lives to safely talk about their feelings. And we also have to take on that mission of being good ambassadors for talking about mental health. So children like yourself, other students across our state and across our country are willing to talk about their mental health needs.
Yeah, it's definitely good to feel comfortable when you're feeling sad or depressed to talk about it, so you know who you can trust.
Exactly, and to know that you're not going to feel judged for talking about those feelings. Nobody judges you or I if we have allergies, right? Like, we can talk about our allergies and that nasty pollen that's outside right now, and we don't fear that. But there's a lot of fear that people still have with talking about feeling sad or depressed or anxious, and we need to be better about that as a society to not judge people for that.
What are some ways we can help each other if you're feeling sad or depressed?
I think the most important thing is patience. Right? So if I get a little kind of statistical or nerdy, you know, we know that 40% of people who need mental health treatment, that's the percentage that will seek it in a given year. That's only 40%. Well, whereas we know that 1 in 5 young people struggle with mental health or mental illness. So we need to be patient. We need to know for a young person, like, you know, and I'm going to use your story, Charlie, because it's a really profound story, and it's one that I think is part of that mark of being good ambassadors for talking about this and getting rid of the stigma. When we can be patient and allow a young person to talk about their feelings without trying to jump in and solve it or fix it for them right away, you know, if I take my therapist hat off and I put my mom hat on, that's a really hard thing to not do. Like, we want to keep our kids safe and we want to protect them and make things better for them. And sometimes it's remembering that we have to just kind of take that step back, take a breath, and wait and let you and other young children talk about those feelings and just be part of that process of talking about it. That solution can come at some point, but really being able to be patient and listen, because I think when young people feel heard, they're more willing to talk about those feelings. And the more they're willing to talk about those feelings, the quicker and easier it is to get to those solutions.
Yeah, even just listening can be a big help.
Absolutely. Listening without feeling like you're being judged or thinking that you're going to get the advice, right? Because as parents, we always like to say, like, well, let me tell you when I was your age, or this is how it happened for me. And being able to just like, no, they don't need to know about what it was like when we were young. We need to just be present in their experience.
Thank you so much for taking the time to meet with me today to talk about this. And remember, you don't have to do this alone.